1 in 10 Montanans deal with substance abuse in some way. Now, today, the Montana Healthcare Foundation held a summit to bring together stakeholders to discuss the future. MTN's Mackenzie Frost reports from Helena.
Substance use disorder. The question that brought state leaders, lawmakers, tribal representatives, and even the 19th Surgeon General to Helena. How do we address the problem?
What we've been doing, we know, is not enough.
The Montana Healthcare Foundation hosted a summit to look at bringing change and help to the 1 in 10 Montanans who are dependent on or abuse drugs or alcohol.
Everybody really feeling like, look, it's a chronic medical problem. People need treatment.
The summit highlighted the need for collaboration between state agencies, especially with budgets shrinking across the board.
We are working collectively with Department of Corrections, with Department of Justice. We all serve certain populations, but they're all impacted by this disease.
One big change is the shift in the way we view addiction.
This is not a character flaw or a moral failing. This is a chronic disease of the brain.
During his tenure as Surgeon General under President Barack Obama, he issued the first ever report on alcohol, drugs, and health.
But I know that a report is not the end, of the journey. It's the start.
To start the journey, Murthy believes more people need to get treatment. Right now, only 10% of people seek help.
And if you can imagine for a moment what it would be like if only 1 in 10 people with diabetes or cancer were getting treatment, we would say that's absolutely unacceptable.
21 million people in America suffer from substance use disorder.
To put that in context, that's more than 1.5 times the number of people with all cancers combined.
It's not maybe as simple as perhaps having high blood pressure where you can take a pill.
The Department of Public Health and Human Services has been able to double the number of providers available to those with substance abuse problems. But Hogan says that came with Medicaid expansion, which she believes is crucial.
I think the evidence is there just from listening to this group. We have to reauthorize Medicaid expansion.
Multiple groups are committed to change, but it won't happen overnight.
It has taken us time to get here. It's going to take us some time to get out of it.
In Helena, Mackenzie Frost, MTN News.
Thanks, Mackenzie. Now, what we also learned today, while the nationwide trend of opioid deaths is growing, Montana actually peaked in 2008 and 2009 and is now on a downward trend.